If you go to some physicians, they'll give you a pill for the diarrhea, they'll give you a pill for the acid, they'll give you a pill for the analgesic for the head, they'll give you an antihistamine, they'll give you an anti-nausea, they'll give you all these pills to get rid of those symptoms. And then they'll label it disease, and they'll actually diagnose this, and you'll pay for a disease treatment. But if you may go to a naturopath or chiropractor or somebody that's a little bit more mind-body oriented, they would ask you a question, so what did you do last night? And you'd say, well, I pigged out. And I said, well, so what? Your body is creating symptoms to let you know that you pigged out, and to cover up those symptoms and continue the behavior is a recipe for disaster for your health.
Welcome to our first video of the Life series at Family Health Advocacy. We are so excited to have a very special guest with us to kickstart this series, Dr. John Demartini. He is considered one of the world's leading authorities on human behavior and personal development. He is the founder of the Demartini Institute, a private research and education organization with a curriculum of over 72 courses covering multiple aspects of human development. He travels 360 days of the year to countries all over the globe where he shares his research and findings in all markets and sectors. He is the author of 40 books published in 29 different languages, and he's produced over 60 CDs and DVDs covering subjects in personal development, relationships, wealth, education, and business. He has created over 72 different courses. The most advanced is a 21-year correspondence course. Each program is designed to assist people to activate leadership and empower all 7 areas of their lives: financial, physical, mental, vocational, spiritual, family, and social. Enjoy. Thank you, Dr. Demartini, for joining us and sharing your wisdom with our Family Health Advocacy online community. We have a worldwide audience that has a special interest in family health, and when it comes to health, more of a natural family health. One of the topics that keeps coming up, we're hearing more of nowadays, is mental health. And unfortunately, when somebody doesn't have the resources or they don't know where to turn, it can have some serious consequences. So what guidance can you give for somebody to improve their mental health naturally and safe?
That's broad. Well, William James, the father of modern psychology, over 120 years ago, stated that the greatest discovery of his generation is that human beings can alter their lives by altering their perceptions and attitudes of mind. So having realistic expectations on life automatically calms down some of the volatilities and vicissitudes of emotion that people face. So getting grounded in expectation is one thing the person can do. For instance, everybody lives by a set of priorities, a set of values in their life. And whatever's highest on their value, they're spontaneously inspired to do and they're committed to doing. So if you meet somebody and you expect them to live in your own highest values instead of their own values, you're going to end up being probably anger and aggressive, feel betrayed and maybe blame them, and you want to criticize them and challenge them and feel despaired and depressed and want to exit and escape them, futile and frustrated and grouchy and grieving and hurt and hated the person because you've expected them to live in your values. At the same time, you can subordinate to other people and try to live in other people's values, and then you'll end up having those same feelings, the A, B, C, D, F, G, H's of negativity towards yourself. So part of the health volatilities that people have are unrealistic expectations. They expect others to live in their values, they expect themselves to live in other people's values, instead of living congruently in alignment with integrity in their own values and expecting other people to do the same. Because that's what's true. Whatever's highest on the value their life revolves around, that's what they want to be loved and appreciated for. So setting realistic expectations is a very important component. Because depression, for instance, can be a result of a comparison between your current reality and an expectation, which is a fantasy that somebody's supposed to be doing something that's not real. Some sort of imbalanced perspective or expectation, or to live in your values. So a lot of those volatile emotional states, even swings in mood, bipolar almost responses, and some dissociative responses are because of these unrealistic expectations. So the first one is setting realistic expectations. Obviously, what we feed our body also can have an impact on our psychology. If we're putting sweets that may increase volatilities, and we're not putting true nutrients in there, and we're not eating wise foods, we can add to that component. But setting realistic expectations is a very important component to have a more sound and more balanced perspective. And putting balanced expectations. Sometimes people, like a magnet, people are trying to get a one-sided magnet in life and not embracing both sides of life. And if I went up to somebody and I expected them to be nice, never mean, kind, never cruel, positive, never negative, one-sided, then I'm setting myself up again for unrealistic expectations. So you have to set objective, balanced expectations on life and let people live in their values, and you allow yourself to live in your values. Those are a lot to do with a lot of the stresses that we face every day.
And when it comes to families and health, nowadays we're starting to see with increased levels of prescription drugs for ADD and ADHD. We know that mental health is affecting children as well. And there's parents out there watching this right now who might be in a really frustrated state because they don't know where to turn. Maybe they've tried medication or they don't want to try medication. What kind of tips could you give these parents? Because they're in the mindset right now that they have a problem child, right? And then they're starting to experience a lot of these frustrated feelings that might also reflect onto this child. So what guidance can you give these parents when it comes to these situations?
Well, first I want to make a comment. I was flying, I think, from South Africa to London, and I was watching on British Airways a particular documentary movie. I think it was called The $1 Billion Deal. And it was a gentleman who was involved in kind of in cahoots between the American Psychiatric Association and one of the pharmaceutical companies, I believe it was Pfizer. And they did what they could to make sure that every child by age 8 was on some sort of medication. They were trying to lower the standards for the diagnosis to make sure that almost normal behavior was clinical, so they could get kids on it. Now schools, as you've probably seen, many of them won't even allow kids in unless they're on some sort of ADHD medication, these type of medications. So just know that there was a documentary that's worth the parents maybe looking at. And also understand that when children are being labeled ADHD or ADD, that same child can sometimes sit at home in front of the video game for 8 hours totally focused. Or they could be doing social media and everything and be completely focused. When they're doing something that's really high on their values, something that's really important spontaneously in their life that's important, they don't need to take the medication all of a sudden. They're now centered and they're focused. They can stay for hours focusing on it. So sometimes the labels are because we have teachers that are not necessarily inspired by the teaching of what they're teaching. We have students that can't see how those classes are going to help them get what they want. There's sometimes an autocratic communication with the children, and they're not really communicating in the children's values and respecting that. They're assuming autocratically that they know what's wise and this is what the kids need to do, which makes them become, in a sense, disobedient, disordered, and these labels, and then they put them on medication. So communicating in children's values, caring enough to find out what the children's highest values really are, and making sure that people are communicating and respecting those values can make a big difference and reduce the probability of having those labels and therefore the need for the medication. But I think it's wise to try to communicate effectively with them. We also know that there's alternative approaches. Chiropractic care has been able to help people with these types of conditions, and also meditation has been able to help people with these conditions, and natural foods and quality eating and quality nutrients are helping that. There's chemistries that we can do, because sometimes these kids are eating just absolutely not food.
Yeah.
And they're wondering how their brain is not working. So a combination of nutrition, a combination with meditation, mental focus, setting realistic expectations, and learning how to communicate and communicate the information for the children in terms of their values. I was in South Africa. We had the Alexandria Township, which is a lower socioeconomic area, and they were having about 27%, I think was the exact number, of kids passing matric, finishing up for their high school equivalency. We went in there and took the teachers, found out what they valued most in life, linked all the classes to those values. They went to the children, the very first classes of the year, and find out what their values were and link all the classes to their values, and then link the values between the teachers and then the children together. And the respect level went up, the disobedience went down, and it went from 27 to 97% of the children passing their matric exams.
Amazing.
It was truly amazing. And the Board of Education, they've just given 50,000 students to us to now implement this. So there's a respect. Children are consumers, and teachers are salespeople. They're selling ideas. And you would never think about selling ideas to people or selling a product to people without caring about the actual customer's needs, and caring about the children's needs and their values and what's important to them, and articulating the value of the class that's important to them in those needs can take a child and make them engaged, less disobedient, less distracted, less wanting to eat sweets, because when they're really engaged, they're more likely to eat to live instead of live to eat. And when they live to eat, they want immediate gratifying sweets and stuff, which makes them more volatile and out of control, makes it more difficult. So it's very important to engage children in their education, engage children when you're communicating as a parent or a teacher. And a lot of these labels and these almost prescribed medications are last of the resorts, not the first resort.
Yeah, I found that really interesting how you use the analogy of the teacher being a salesperson and the student being the consumer, because you can actually reflect that on many situations in life when you talk about the values. Obviously, there's a lot of people watching this right now in our community who experience physical pain. Do you think that improving your mental health can resolve physical symptoms?
Well, there's no doubt in that. I don't think anybody really would question that. Now, there's many conditions, whatever that is, diagnoses, conditions, that have been questioned about how much is psychosomatic or not. But I've been involved in presenting a program called the Breakthrough Experience. You've probably heard me mention it. I've done it for over 30 years. And we have had hundreds, I mean even thousands of people that have been referred to it by physicians, doctors, chiropractors, all different health professionals, psychiatric, psychologies, sent there for various types of emotional or physical or symptomatic conditions. And a lot of them clear up. I mean, a vast number of them clear up. So there's no doubt in my mind that as people start to prioritize their life and fill their day with things that are truly important, truly meaningful, they start setting realistic expectations on themselves and other people. They learn to communicate effectively what they value in terms of what other people value. They start to fill their day with things that are meaningful and learning the art of saying no to things that aren't, and possibly delegating things if they have the capacity to delegate, to reduce the distress levels and to increase the eustress levels. Without a doubt, many conditions change. I've seen people with irritable bowel syndrome. I've seen people that have cardiovascular hypertension. I've seen people that have chronic headaches. I've seen people that have shoulder problems and back problems. I mean, the list goes on and on. And we have hundreds of people that have sent in thank you letters to people who, when they start to manage their life wisely, their physiology gives them feedback that they're now living wisely. And they're more likely to eat wisely. There's no way you can build a great body if you're feeding it with things that aren't really food. Mm-hmm. There's no way you can build a great body if you're feeding it with ideas that aren't inspiring. So, yeah, there's no question in my mind that there's a relationship between mind and body, and if we organize and prioritize and, in a sense, systematize the brain and the mind's function on a daily basis and start filling our day with really things that inspire us, we bring about healing. I always say that love is still the greatest of all healers. When we are loving our life and loving the people we're participating in and doing what we love, amazing things transform in healing.
Yeah, and I always talk about it with my patients too. Symptoms are a feedback mechanism. It's your body speaking to you.
Exactly.
What the underlying causes could be mental.
You know, it's interesting. I joke with people sometimes. I tell people that if you were to go and eat a pizza, for instance, a giant pizza, and then afterwards have a big bowl of spaghetti, and then after that go and have a steak, and after that have a cheesecake, and after that have a big bowl of prunes or something, and eat just outrageously binge food. And the next morning you wake up and you've got a stomach ache, and you got a headache, and you got indigestion, and you've got a stuffy nose, and you got cramps, and you have diarrhea, and all those things. If you go to some physicians, they'll give you a pill for the diarrhea, they'll give you a pill for the acids, they'll give you a pill for the analgesic for the head, they'll give you an antihistamine, they'll give you an anti-nausea, they'll give you all these pills to get rid of those symptoms. And then they'll label it disease, and they'll actually diagnose this, and you'll pay for a disease treatment. But if you may go to a naturopath or chiropractor or somebody that's a little bit more mind-body oriented, they would ask you a question, so what did you do last night? And you'd say, well, I pigged out. I said, well, so what? Your body is creating symptoms to let you know that you pigged out, and to cover up those symptoms and continue the behavior is a recipe for disaster for your health. So your body's symptoms may actually be healthy. They're feedback systems, as you said, to guide people to live wisely. But we've lost contact, and we're not in touch with what those body symptoms are really revealing. And that holds us back from really maximizing our potential sometimes. So we cover things up with immediate gratification, a quick magic bullet, instead of actually learn the wisdom of our body, as Walter Cannon said in his great text, and use that wisely to guide our lives. So I'm involved in trying to educate people, I'm sure like yourself, on what the body is trying to say so they can learn. So instead of giving them a fish for the day, you're teaching them how to fish for life.
Yeah, that's exactly what a lot of people need, because as you're going through the day on what they were eating, that's most people. And most people in our society, especially here in North America, are suffering from symptoms.
Well, they are, and I don't think they even have any idea. We're so used to having on television commercials that are say, take this for this, take this for this, take this for this. Mm-hmm. They immediately, like an impulse, they're sheep, and they're, instead of being shepherds and thinking for themselves, they conform and they just fit in and they just do something impulsive without looking at side effects, looking at what the repercussions are. And I just say that if you're out there, make sure when you do something through an education process and really inform yourself, because informed decision is wiser. And people don't do that sometimes. They just give away their authority to somebody, especially that they think has more knowledge than them, which they may actually be somebody that has an internal conflict of interest. They may be promoting something that's an economic value to them, but not necessarily the greatest for yourself. So I'm not saying that there's not a place for that, because there certainly is, but at the same time, that's not the first choice.
Yeah.
The first choice is to not diminish the power of your own body, because the power that makes the body is really what heals the body. And the capacities we have, I don't know of anybody that really has the wisdom on the outside of what the cells and the body has on the inside. If you took 100 Nobel Prize winning physiologists and biologists together, put them in a conference, and try to figure out how a cell works, they wouldn't come close to what the cell can do. And what's interesting is 4.1 billion years ago, there was a cell on the planet before there was anybody with all this intelligence. So we don't have the knowledge of what the wisdom of the body already has. So using it and capitalizing it and allowing that to honor itself is the wisest thing to do, instead of just, overruling it with what partial information can do.
Mm-hmm. And I think a lot of people, when they do have these symptoms, when their body's speaking to them, like you said, they just mask it. They tell it to be quiet rather than listen to it. So I like that you've brought that up. But most people think everything's just physical. If there must be a torn something or a broken something or a burst something.
Well, if the history shows that's remotely possible, or possible. But even injuries, I did some studies. I started when I was in practice many years ago. I got very interesting histories. So you were in a car crash. What's going on in your life? And sometimes you'd see metaphors being revealed as almost like injuries of meaning. There was a higher meaning behind some of these injuries. I had one lady, I'll give an example. They came in my office and she said, I just had a car accident on top of a bridge, and I got spun around and got injured in there and bruised and everything else. And she didn't hit any cars. She hit the railing herself. And as she was going over the bridge, I said, because I knew her, she'd already been a patient, she came in for this new injury. And I said, so what do you think was in your mind at the moment this was happening? And she didn't want to go there. She didn't want to discuss it. And she actually walked out of my office. She was offended by that, me asking that question. I was just asking the question what was going on in her mind at the time of the injury. And I don't think that's an outrageous question. That's an important question. And she came back the next day, she says, Dr. Demartini, you hit a button with me, and I didn't want to face it, but I'm back now, and I'm calm enough to be able to handle it. And then she admitted, she said, I was going over a bridge to meet a man to have an affair with. And you know my husband, that's why I reacted. And I didn't want to say, but I was afraid of going over that bridge because I knew if I went on the other side of that bridge, there'd be no turning back. It'd be the end of my marriage. And I was scared to do that. And I was so in this altered state as I was going across the bridge, I wasn't really anywhere. I was just thinking in my mind, not present in my driving, and just thinking of what's going to happen. And I was completely distracted, and I ran right into a guardrail. And I spun the car, and the car was facing where my husband was at the home. And when I came out of that, and I looked at that, and I saw that, and then I contacted my husband, he was right there for me. And I unconsciously wanted to make sure that he really cared about me. And he was the first one there, and he stopped what he was doing, and he cared for me. And I confirmed that I wanted to be with my husband. Do you think it's remotely possible that my accent was actually just my subconscious mind making sure I was getting my answer? And I said, I don't need to say anything. I think you did a great analysis. Freud would be proud of you. But I see things like that. I saw an individual that all of a sudden he was concerned. He was in a marriage, and he was in a sport, and he was really a great sportsman. But he thought the wife was telling him that if you're not home enough, she was gonna leave him. And he was in this situation where he got injured, so he would have to stop that sport to not destroy his marriage because he had a higher value on his marriage, even though he loved the sport. And he injured himself to make sure that he was there and she wouldn't leave him. And it was obvious, and we got in there and asked him, and we narrowed down what was actually going on. So I see metaphors of why people injure themselves, why they are going and eating out. I had a lady that was overeating. It was a reality TV show we were doing, and she was pigging out and pigging out and pigging out. We started asking her, what's the benefit she's getting? And she goes, there's no benefit to this. We looked deeper and found out that everybody in her family was large, and if she wasn't big, she didn't feel she was part of the family. Then her bigger sister was always pushing her around, and she never would let herself get smaller than her sister. And then she found out that when all of a sudden she had started to lose weight one time on this really crash diet, a guy hit on her, and she thought, oh my God, it's the first man I've ever been with in my life, and she ended up becoming in love with him, she thought, at least infatuated. They made love right away, and she found out pregnant, and he disappeared and never saw her again. And now she's a Catholic girl with the paradox of having to decide whether I keep the baby or not and abort, and either way she doesn't win. She has a baby that she doesn't want with a man she doesn't want to be with, or she has an abortion, and the turmoil of this. So she swore I would never lose weight again, because the last time I lost weight, I got in this situation. It was too painful. And she had unconscious motives for creating these conditions. And so I see that sometime working with people. And so you asked me about the mind-body. There's no doubt in my mind there are unconscious motives in people for getting things to happen physiologically, psychologically, injury-wise, nutrition-wise, eating-wise. So to not include that in healthcare, I think is missing out on some of the components of giving people their power back. Otherwise, they're dependent on something on the outside.
And that's exactly it. People are looking for the answer outside and having a hard time looking on the inside.
Well, I think giving people their power back is not as lucrative to some professionals, but it is more fulfilling to professionals. I would rather have new clients getting results than the same client being stuck in the same pattern.
Exactly. And they'll refer more clients.
That's my experience. I'd much rather have make a difference in their lives and keep it moving and get new people and referrals than I would be stuck on the same thing. The model of a redundant system is not as inspiring to me. Now, that doesn't mean that there's not patients that do require long-term treatments and care. There are, but not the ones that are just psychologically repeating bad behaviors and creating chronic conditions, that's all. Educating them, I think, is the key.
Now, when we talk about pain, and we know that our mindset can put us into a painful state, a physical painful state, whether it be unbalanced emotions or thoughts. For some people, relationships instigate them to be in an unbalanced state or have unbalanced thoughts. Oftentimes it's relationships they have for a long time. Maybe it's a marriage, or maybe it's someone in their life since they've been with since they were a child. What kind of tips would you give somebody to have a healthy relationship?
Well, every human being, as I said, lives by a set of priorities, a set of values. And whatever those values are, whatever's high on the values is what they're spontaneously committed to doing and fulfilling to them. They spontaneously do that. Just like the young boy who loves his video games. Nobody has to remind him to do his video games. But they got to motivate him extrinsically to do the homework, the chores, and clean the room. But his video games, he spontaneously does. Well, everybody has something that they spontaneously love doing. And their identity revolves around that. That's what's important to them. So if you know that, you know what they're really about. And people want to be loved for that and appreciated for that. So if you want to have a great relationship without all the trauma and the crazies that come with it, you have to care enough about the individual to find out what's really important to that individual. And then care enough about yourself to find out what's really important to you and make a link between them. One of the greatest questions I found in relationships is how specifically is what they're dedicated to, their highest values, what's most meaningful and inspiring to them, that they love doing. How's it helping me do that? How's it helping me fulfill what I'm most inspired by, what I'm committed to? And if I can see that, I don't need to change them. I don't need to fix them. I don't need to project onto them. And I'm more likely to respect them and communicate effectively in them. Because when you really have somebody you respect, you take the time to care to communicate effectively. And at the same time, ask how specific is what I'm dedicated to, helping them fulfill what they're dedicated to. The more links you have, the more dialogue you end up with, and not alternating monologues where you're speaking, they're not listening, they're speaking, you're not listening, and you're both projecting and expecting them to change, and both being pride and arrogant, thinking the other person's supposed to live in the other person's values. And that undermines relationships. And it also creates tension and sympathetic responses and futilities and frustrations, and then people have affairs, and then they have guilt, and then they end up injuries. I mean, I could go on and on. Cardiovascular conditions are developed, digestive involvements are there. And skin conditions, I've seen those because of not caring enough to communicate with each other's values and setting unrealistic expectations.
For some people, it's easy for them to answer the question, what inspires you? Or what do you feel like your purpose in life is? For other people, it's almost weighing them down and spiraling them into a state of confusion, depression, lowered self-worth. How would you recommend, or where would you point someone in the direction to help them find their inspiration and purpose in life?
Yeah. Well, I've been doing that for many, many years, so that's something I deal with every single week. Again, everybody has a set of priorities and values that they have in their life. They're automatically there. It's not something that your parents taught you. It's something you're already born with and that's evolving through your life. Anytime you're living by highest priority things, your self-worth goes up. Anytime you're living by lower priority things, your self-worth goes down. And you start beating yourself up, and you start questioning yourself, and you're uncertain. But if you live by highest priorities and fill your day with high priority actions, it doesn't fill up with low priority distractions, and you don't depreciate. Now, the second you meet somebody, let's say you're walking in a mall and you meet somebody and you think, oh God, they're more intelligent than I am. They're more achieving and successful than I am. They have more wealth than I am. They have a better, more stable relationship than I do. They have more social savvy and more social influence than I do. They're better looking or hotter than I am, or they're more spiritually aware than I am. The moment you compare yourself to them and put them on a pedestal and minimize yourself, and you start to envy them and you try to imitate them and try to be something like them, you inject their values into your life. You cloud the clarity of what you're committed to, your calling, your purpose, which is your highest value. And then you doubt yourself and you self-depreciate, just like you're describing. And you give up on being you and you try to fit in. And then the fear of rejection, because you don't want to lose something that you're infatuated with. So your fear of rejection then gets you trapped into a vicious cycle of self-depreciation. But the second you give yourself permission to identify what's really valuable to you, and then prioritize your life and not compare yourself to others, but compare your daily actions to what you really value, your life starts to bloom again and starts to unfold and get clear again, and you build momentum towards what's you're certain and what you would love to dedicate to. And that's a major change, and I get to watch that every week. One thing I'm certain about, I'm 65 almost, and I have more energy than most people that I meet. And I know because I'm clear about what I'm committed to. I've been doing it for 46 years. I'm focused on it. And that your vitality in life is proportional to the vividness of your vision and the more congruency of the communication you have. And if you can see it in your mind's eye, you can achieve it. So I'm a firm believer that helping people do that helps their health, helps all areas of life that I just mentioned. and giving yourself permission to be you. The magnificence of who you are is far greater than any fantasies that you impose on yourself trying to be somebody you're not.
And you'll be able to be with your family if you know you best and you start to live in your values. Your family's going to be happier for it.
Well, when you love you and you appreciate yourself and are thankful for your life, you're a whole lot easier to get along with, and you're a lot more adaptable to other people's vicissitudes. So, yeah, you're more realistic in life, and that's the grounding. It's the unrealistic expectations you have on life, on yourself or other people, that cause a lot of challenges.
So thank you again so much for imparting your wisdom with us. I know I appreciate every time I speak with you and I hear you speak. I know hands-on that we can get your book at any major bookstore. But there's some people who are watching right now who are ready to jump right in, and even further than doing the
Value
value
determination.
determination, yes, on your website. What would be next? Like what recommendations do you make for some people?
Well, I'll just say to whoever's watching here, you want to give yourself permission to do something extraordinary on the planet. The real you is unique, and you have a desire to make a difference. And the difference you make is your authentic self. If you try to be somebody you're not, you're going to depreciate your capacity to make that difference. So identifying what's really important to you, and then knowing that because you have a difference to make, you want to fuel your body and feed your body with the greatest food you can. You want to associate with the greatest, most inspiring people you can. You want to fill your mind with the greatest information you can. And you want to spend your day doing the highest priority actions you can. And then you want to surround yourself with people that really care about your mastery, and care about you health-wise, and care about you as far as relationship-wise. So there's millions of people in your life, and you have the capacity to say yes to the things that are helping you get your dreams. And by doing it, you give, in a sense, permission for other people to do the same. Anybody that lives an inspiring life inspires other people as a chain reaction, a ripple effect, and you make a difference in the world just by doing that. So give yourself permission to be yourself. It's the most magnificent you can have. And then just know that that will make a difference in the world.
Wonderful. And I know you're featured in many documentaries. It's always nice to see you on screen. Rumor has it that something's coming up on Netflix. Do you want to tell us more about that?
Well, we've been asked to do a movie. We're in the process of doing a movie on my life, and also Netflix wants to do a series on some of the methodologies that I've developed to help people with grief and panic attacks and anxiety and depression and conflict and all kinds of things. So that's in motion, and I'm looking forward to those. Every day and every week is new opportunities and new adventures, so I can't complain too much. I'm pretty blessed.
And we look forward to your continued success on your journey, and I'm thankful and I'm grateful that I can help you get your message out to more people.
No, thank you. I appreciate that, and thank you for caring enough about other people to make that difference.